Hello there, I'm Patience Kasumba, a peer educator right here at Chalimbana University, and I want to educate you about a common topic that affects students, sexually transmitted infections. So what are sexually transmitted infections? These are infections that are passed on from one infected person to another person. So these infections they can be shared among people when they have unprotected sexual intercourse. Unprotected sexual intercourse they involve having vaginal sex, unprotected vaginal sex, oral sex, also known as a blowjob, and also anal sex. Yes, many people believe that you can get an STI by having unprotected vaginal sex with a person, but you can also get STI by giving someone a blowjob, what we call oral sex, and also having unprotected anal sex with someone. As STIs can also be transmitted from a mother to a child during childbirth and also breastfeeding. So moving on, I'll talk about the causes. So most people wonder what really causes STIs. So STIs are caused by small microorganisms such as bacteria, viruses, and the parasites. Moving on, I'll talk about the common types of STIs, and these include gonorrhea, syphilis, genital warts, and HIV. So these STIs are transmitted from one person to another through vaginal fluid, semen, and also blood. I'll talk about the general signs and symptoms of STIs. So how can you know that you have STIs? First of all, you begin to notice unusual discharge from the vagina or the penis, and often this discharge, it is very smelly, stinky. That's one sign that you can know that you have STIs. And also itchiness or irritation around the genital area, either in a man or a female. And you also begin to experience painful sexual intercourse. You begin to experience pain during urination. So most of these sexually transmitted infections, some are curable and others are not curable. For instance, I can mention of HIV, which is not curable. So let us be careful and avoid these.
Hi, my name is Sebum Shapa, and I'm going to talk about the dangers of STIs on teenage health. Well, what are these dangers of STIs on teenage health? I'm going to talk about the three common effects, which is mental and emotional health problems. Having mental and emotional health problems may cause. Hi, my name is Sebum Shapa, and I'm going to talk about the dangers of STIs on health teenagers. Okay, so what are these dangers of STIs on teenagers? Well, emotional and mental health problems. This may be caused by having STIs. One can begin to have some insecurities like having stress and fear, even depression about the worry of their health, and also high risk of HIV. This can be caused by having STIs may cause one to have HIV because the body becomes more vulnerable to infections. And also the poor academic performance. Having STIs can cause one to have poor academic due to absenteeism over classes and fear to attend classes due to some sicknesses. Thank you.
Hello, my name is Vincent Mpundu, a peer educator at Chalimbana University. I'm going to talk about how a teenager can prevent him or herself from contacting STIs and STDs. By the way, a teenager is anyone in between 13 and 19 years. So how can one prevent these STIs and STDs? One, we can talk about abstinence. This is the best way of preventing these STIs and STDs. But we know that time will come when one won't be abstaining anymore. Like when you get married, meaning you stop abstaining. That's why we have a lot of preventive measures that we can put in place. Like we can talk about using correct and consistent use of condom. The reason why we said correct, because some people they use it incorrectly. That's why we say you should use it correctly and consistently. You can prevent yourself from getting these STIs and STDs by using condoms. Not only that, but also we can talk about reducing number of sexual partners. If you reduce numbers of sexual partners, you are preventing yourself from getting STIs and STDs. As if that is not enough, you can also be visiting the health facility regularly for medical checkup in case you find yourself in problems, or rather you find yourself being a victim. You can go there, you get medication as early as possible, because when you delay,